Hello again, Destin Whipple here with VOSH Arizona. This is our short video clip about triage. Triage was a station that we put in the middle of our patient flow to help us be more efficient. This station is ran by optometrists and or optometry students usually. This is the point in the clinic where sometimes it's apparent by the information that we've already taken in the first 4 stations that maybe this individual does not need to go to all of the remaining stations, or maybe they need to go in a different order. I want to give you a couple of common examples. First is somebody who has presbyopia and may just need reading glasses. So this is a situation where somebody who is 45 or 50 years old who comes to the clinic, their main complaint is that they can't see up close. Their distance vision they feel is fine, and when we do the visual acuity and auto refraction, we're able to look at those things and realize, yeah, it looks like their distance vision is just fine, and their near vision isn't good. And so we may have this person skip refraction and just go straight on to ocular disease, or we may do an eye health exam right there in triage, especially if ocular disease might be more busy at the moment, and go ahead and do the eye health exam right there, and then send them on to optical to get reading glasses and sunglasses. So that's a very common situation where a lot of times they don't need to go through refraction because we can tell that they don't need glasses for distance. Another fairly common situation that we can catch in triage is somebody who has very dense cataracts. So this person, is much older, likely in their 60s, 70s, 80s, and they may complain of not being able to see much at all. And in visual acuity and auto refraction, we're able to confirm those things. And at triage, we might take a quick look with an ophthalmoscope and notice that there are substantial, very thick cataracts. And just depending on the situation, we may, again, have them skip refraction because it may be apparent that there's just not much potential to improve their vision there. And so then we may do dilate their eyes and look at the internal health right there in triage, where we might put dilation drops in and send them over to ocular disease for the exam there, and then make the appropriate referrals for them to get cataract surgery. Again, these are the ones that are quite dense and very apparent that glasses just really aren't going to help this person. So if the cataracts are mild or moderate, we might most likely will still send them through refraction because we're not sure a lot of times how quickly cataract surgery will happen. And if we can help them in the meantime, we do want to do that. So those are a couple of fairly common situations we run into with triage that we're able to kind of expedite the process for patients and move them along, either have them skip stations or maybe do them in different orders. That is triage.